Welcome to Awakening Within. I'm your host, Jill McPherson. On today's show, we're talking about mental wellness and you. We're talking about the importance of taking care of not only our bodies, but our minds as well. And I have a guest in with me today, Catherine Carpenko, who's a registered psychotherapist. Welcome, Catherine.
Thank you very much. It's a pleasure to be here.
Well, today I want to talk about mental wellness. There's a lot of talk recently about, well, actually, a lot of people are calling it mental illness. And I noticed when we talked prior to the show that you really stressed mental wellness. So maybe we could just pick up there. Why is it that you want to shift that label to mental wellness?
Well, I think the idea of mental illness has a lot of stigma. So when we think of somebody being mentally ill, there's all kinds of connotations that go with that they're crazy or that it's something that's frightening. But just like when we ask someone, we think of their physical wellness, we don't say, how's your physical illness?
Right.
It'd be really nice to think of ourselves as, how's my mental wellness?
Right.
Am I taking good care of myself mentally? Am I
Right.
taking good care of myself physically?
Right.
And that just puts it in a different context, that it's kind of like a preventative way of thinking about ourselves, rather than waiting till our leg is broken or we're physically sick, that we haven't been paying attention to our health. It's the same thing with our mind.
Right. Okay, good. And also, I think that what comes to me for mental illness too is that there's this idea that it's some sort of like a sickness or disease, but what we want to focus on is just more about maintaining or creating mental wellness for everybody. It's not just one small group of the population. This is about everybody focusing on mental wellness.
For sure, because if we were to make the analogy with physical wellness, we go through our lives, and sometimes we're well, and sometimes we get the flu, and sometimes we break our leg. So we actually go through a continuum of being well and then not being as well.
Right.
But we make the assumption that I have to be mentally well for my entire life. And if I'm not, then there's something wrong with me. But you wouldn't think that about getting the chicken pox
Right.
or getting the flu,
Right.
that there was something wrong with you. This is part of being a human being in the course of their life.
Okay, good. So that just leads into perfectly, because I want to really shed light on strategies for people to maintain or create mental wellness. As you say, sometimes we have these little oopsie moments where, physically we might break our leg and then we have to heal ourselves, and we still might have that in our minds where we have challenging moments or challenging times where we're struggling to feel mentally well. And so for any of our viewers who might be in a moment like that, where they're struggling to feel mentally well, what are some things that you would suggest?
So all of us go through times when we don't feel so great. And
Right.
often we push ourselves and think, well, I don't feel good, but I'm still going to do whatever it is that we're doing. Continue expecting ourselves to perform well when it's just not possible.
Right.
At those times, just like when you break your leg, you go to the hospital and you get attendance. When your heart is broken or issues arise in your life that it's difficult to cope with, you also need to reach out and get assistance. And there's many ways to do that.
Okay, I like that analogy. Yeah, because we don't hesitate if we're sick to go to the doctor, or if we need to go to the hospital. We do that because something is needing attending. So same with our minds. So if we're struggling, there's nothing wrong then with going. Actually kind of makes sense to just go and get some help. So where would you suggest somebody start with that?
Well, the first thing is to identify that you are having difficulty and not feel ashamed that that's the case.
Right.
I remember when my children were going to school and they would feel like they had to make an excuse for not to go to school. And I said, why don't you want to go? And I would feel really bad today. So do you want a mental health day? Yes, I do. And they would stay home from school. And that was inviting them to take care of when they didn't feel well. In their
Okay.
minds. So it's identifying when you're not feeling well first. And then the opportunities depend on what's in your community, in part.
Right.
So for some people, they can go to somebody at their church, in the spiritual community, who can help them. But there's also people who are trained professionally to assist people, like myself, who work as counselors in various different capacities, addiction counselors, psychotherapists. There's lots of opportunity. And the Canadian Mental Health Association's website usually lists the people that are available in the community, or the internet certainly has that available.
Right. Okay, so let's say they find someone, or even let's walk through an experience of coming to see Catherine Carpenko. What would that involve? What would somebody expect if they've never done this before and they're feeling a little bit nervous about, what's going to happen when I show up?
For sure. So It depends on how. Sometimes people come by referral, so they already know somebody who sees a practitioner or myself and can ask, what's that person like? I like that person, I don't like that person. And then they call or they email and they say, I've got a problem and I need to talk to somebody about it. And then they come in for an initial visit. And that visit generally, depending on the practitioner, there's no charge for that. It's kind of a meet and greet. What's going on for you? Here's what I do. What is it that you need? Do we have a match?
Right.
And do you feel comfortable with me? Because the rapport between the person that you're talking to and yourself is one of the healing properties of that relationship. It's not just getting a delivery of a pizza.
Right.
You're actually sharing really intimate personal things with someone, so you got to feel like they really, you have a rapport with them.
Right. Okay.
And you can trust them.
Right. So many will offer like an assessment kind of this initial visit.
And
consultation.
It's a consultation. Assessment
better.
is a different, because that's often when there's a diagnosis and stuff like that. This is more just to size each other up.
Right. And see if it's a match.
And see if it's a match. It's as simple as that. And certainly person should find someone with whom they feel very comfortable, not feel compelled that they have to go to the first person that they talk to.
Right.
And most therapists and counselors really appreciate that.
Right. Okay, good. So I'm just trying to think of, there's definitely still some issues, concerns people have, like stigma around pursuing help. Is there anything else that you would offer that could help somebody make that first step? Or
well, it's important to remember that there's, in the practice as a counselor or a psychotherapist or anybody who's helping in that capacity, just like with a doctor, there's confidentiality. That anything that you share, the fact that you are attending is completely confidential and private, and that information is not public information.
Okay.
So that's really important to know that. In small communities, it's a little more difficult.
Right.
So I'll just share with you, my practice is that if I see somebody who's seeing me on the street or the grocery store, I won't acknowledge them unless they make that acknowledgement first.
Okay.
So if they say, oh, hi, Catherine, I'll go, oh, hi. And
Right.
we might have a chat or not have a chat. But otherwise, I just go about my business and they go about their business so that they have the privacy that they deserve.
Okay.
Is that what you were?
Yes. Yeah, so another reassurance. Yeah. And how do you find that people, when they first come in, what's sort of the first initial response or reaction to it? Like, I'm thinking of an analogy, it came to me actually when I was driving to the studio, of cleaning out a closet. So, maybe you have that cluttered closet that's been bugging you and you finally decide you're going to clean out the closet. And in the process, we all know, if anybody who's cleaned out a closet, especially if it always gets worse before it gets better. Like all of a sudden now I have a way bigger mess, and I think if I just left the closet alone, now it's this like overwhelming kind of mess. Do you find that there's sort of like that experience with some people where they go in, they're going to solve a problem, and it almost feels like it gets worse before it gets better?
It depends, because some people just come for something, there's a transition in a relationship and they're very upset about it, or there's a death. And then it's very clear they need help with that particular issue. There's other people who come in and they're looking at understanding deeper things about why they are feeling the way they have been feeling for many, many years. That process is a little bit different. But pretty much across the board, I find that people come in and they start to talk, and the first thing they feel is relief that they can share what's going on that they've either been ashamed of or it's been a burden for them. And also they get reassurance that they're going to be okay.
Right.
And that is also a relief.
Right. Okay.
And encouraging, I think, as well.
Right. So it sounds like also there's some, validation that there's somebody hearing them saying, I hear you and this is real.
Yeah.
And then does it lead into any like advice giving, or like is somebody, I know I heard somebody say to me once, I'm not going to pay someone to tell me what to do. How would you respond to that?
Well, I don't tell people what to do.
Okay.
So I explore with people how they're feeling, and then we find out what would make them feel better than how they're feeling, what they're unhappy about. So It's not really about giving advice. It's more about going on a journey with the person, being a partner with them in parts of their experience that they found frightening or uncomfortable.
Okay. And so you're saying then that as they talk it through with you, then almost like solutions come up for them. through the talking?
Or an inquiry. So I would ask questions. So when did you start feeling this way? Or what do you feel that means for you? So it's actually a really, it's a bit of an adventure, but it also can be really emotional because often we are upset about our feelings because we've been trying to avoid them. So you're absolutely right that sometimes these feelings come up, but the ideal is that they come up in a safe and secure environment, that it's okay to feel those feelings. Maybe in other situations it wasn't okay to feel those feelings.
Right, so now they're feeling it. Now, when you say like where these come from, then is there a lot of like going into the past? Like, I mean, some people might be hesitant about, I don't want to, like the past is the past, it's over, it's over. So what would you say to that?
So different practitioners work differently. But
Okay.
in my particular approach is that I don't go into the history except how it applies to the present moment. So what are the issues that are challenging you today? And how does this relate? Like, why do you find yourself in this situation? And often people say, well, that's because when this happened in the past. Oh, okay, so now we can see what affected you, some time ago that's still presenting itself as an obstacle for you today. And so mine is about being in the present moment and applying mindfulness in terms of what am I experiencing in this moment and what is its relationship to my past or my future. Sometimes people are very anxious because they're frightened of the future.
Right. So it's kind of making a connection to see a pattern or to see, but not to blame.
Oh, absolutely not.
Right.
But it's about taking responsibility but not blame.
Right.
We're all a compilation of everything we've ever experienced.
Right.
We aren't just today start anew, nothing that's ever happened before affects us. That's just not what human beings are.
Right.
So it's about recognizing who we are today, what has affected us, and taking responsibility. We can change the past by how we are in the present. We can't change the events necessarily, but we can change our perspective.
So so our perception on it. So
That's
instead
right.
of looking in the past and seeing yourself as a victim of some incident, perhaps, looking at it that in that moment, possibly everybody was doing the best they could, and then learning from that.
So from my perspective,
okay.
I work with the client, so it's from the client did the best they could.
Gotcha. Okay.
They're the center of my attention. It's not
Yes.
about I can't talk to anyone who isn't in the room. So
Right.
it's not, maybe everybody else did do their best. I don't really know, but it's about the client recognizing, right, in that moment under those circumstances, I did the best that I could given all of the
All the
deck of cards
factors.
that I got dealt.
Right.
This was the best hand I could play at that moment.
The thoughts I had in my head at that moment, the
Yeah.
beliefs I had.
Yeah.
Right. Yeah. Okay, good. Because we often hear about blaming people or blaming, of course, mother blaming, which I don't like that one. I've got 4 kids. Don't like, no mother blaming here. And because we surrender our power, don't we, when we blame others? We, because then we're like letting it be somewhere else instead of the power within us.
Yeah, we're saying that person has control over me.
Right.
In that moment.
Right, great. We're really shedding some light on how we can work to create or maintain our own mental wellness. And I have my guest with us, a registered psychotherapist, Catherine Carpenko. I'm so glad you're here. And when I said registered psychotherapist, that just made me realize, let's speak to that. That's a new title that's come up within the province of Ontario. Is that what you were saying before?
Yes. So as of April 1st, 2015, the province of Ontario has registered psychotherapists that qualify they've set up a college so that now we are licensed in the province, which is great because there wasn't the recognition of our profession for the longest time, not unlike midwifery. It took until 1994 before they were legislated and were registered to practice legally in the province.
Right.
So now it's going to take a couple of years. There's been lots of people who've been practicing psychotherapy, and a number of us are being grandparented into it. So that's one way to be able to differentiate between what people are practicing. Some people will be practicing many different kinds of therapy, but psychotherapy now will be registered. People will be registered and licensed to practice.
Right. Because how long have you been practicing?
About 20 years.
About 20 years. So now you're under a college.
Yes.
Basically, a governing body.
That's correct.
That
Regulates and protects the public from practitioners who are not practicing well. So you got some sort of confidence in the kind of people that you're going to be working with. Now, there's other ways that people are also registered. Registered nurses, for instance, under their college, they're allowed to be counselors. So it's not just, ours isn't the only college, but it is one particular college specifically for psychotherapy.
Right, that somebody could pursue that then.
For
okay.
sure.
Okay, great. And when we were talking before too, we were talking about how, if we are physically ill in any way, we would pursue, a medical care. If we needed to go to the dentist, we go to the dentist. So if we are struggling mentally, there's nothing wrong with going to pursue and get help. That's we were talking about that before the break. And so, what would you say? Again, is maybe some strategies that some people that you might offer people if they came to see you? I mean, is it just not just, maybe that's all it's needed, is just talking, or is there other things?
Well, actually, I just want to clarify something, because when we think about mental illness, it's like, what exactly is sick?
Okay.
Is it our mind? Is it our emotions? Is it our spirit? What is it that's not well?
Okay.
And psychology, psych, meant soul. So originally it was the study of the soul. That's what psychology meant. And so there's a spiritual element to this as well. But generally we think of mental unwellness is when people can't think clearly, when they're upset and they can't function, where they're not feeling good about themselves. So it's actually a combination of all those things, of their emotions and of their thinking patterns. So there are types of therapy that address how you think, called cognitive behavioral therapy. So there's a number of approaches that can be for specific people's way their issues are.
Okay.
So for some, if it's an emotional issue that they have trouble regulating rage, for instance, then the approach would be a specific way or a number of ways. And if it was that they were obsessively thinking about things and it made their anxiety be elevated, then cognitive behavioral therapy would be ideal for that. So there's a number of approaches depending on what the issue is for the individual.
Okay.
You can kind of custom do it.
Right. Okay, so let's just take that as an example. So, for those who maybe haven't heard that term, cognitive behavioral therapy, describe that to me.
So that approach is where you, with your counselor or therapist, you look at what is it that you think and how does it make you feel when you think certain things.
Okay.
And when you think other things, how does that make you feel? And you start to see the relationship between your thinking patterns and your emotional experience. So all of us from time to time experience negative self-talk. I'm not good enough. Why didn't I do this? I should have been better. It's sort of a normal thing that happens for all of us, but sometimes it gets really out of hand that's the only thing we hear. So it's about recognizing, right, the way that I'm thinking's not helping me to feel good about myself. And actually we can change the way we think. We can pay attention through our awareness, through consciously paying attention to how we feel and what we are saying to ourselves. We can change our patterns and then change how we feel.
Right. And for sure, I think everybody watching has had that moment of self-sabotage, that the mental dialogue in the head is going like, I can't believe you did this, your dad always said you'd be a failure, and there you are, whatever is coming up. And so it's addressing that mental dialogue.
That's what cognitive behavioral therapy particularly does. Then there's other kinds, psychodynamic therapy, for instance, and that's one that deals with the emotions. So if somebody says, I've got all these feelings and I can't let myself feel them because I'm afraid it's bad to feel this way or that way. So it's about addressing the emotions and understanding that it's okay that you have these feelings, and there are ways of regulating those feelings so you don't feel overwhelmed all the time. And that's called psychodynamic. So there's a lot of different approaches, and so part of choosing what works for you is being very clear about what your distress is, and that will kind of point you in the direction of what kind of therapy that would be ideal for you.
Right. Okay. So, and perhaps even one person, in this moment right now, this type of therapy may be ideal, and then they might find that they shift and pursue some other type. Is that possible too?
That's possible. Lots of practitioners actually are well versed in a number of modalities, we call them.
Okay.
So for instance, I have experience working with people with trauma. So that's one thing. I also work with people who have a lot of anxiety or depression. There's certain things that are pretty common. In our culture, anxiety and depression is very high.
Right.
Whereas it used to be other things that many years ago was a different type of presentation of people's distress.
Okay. And why do you think that is? That just really piques my interest there. Like, why is it that you have, that we have a lot in our general population of people who are overwhelmingly depressed or anxious?
That's a really big question. It's like saying, what causes cancer?
Right.
There's so many things that play upon us, but we do know that when people live in close quarters, in large numbers, and don't have a sense of community or connectedness, they tend to feel unwell faster than people who live and have a sense of community and feel connected to other people. So the isolation that comes with urban living and our culture where we're texting and not actually having a face-to-face communication, people tend to feel more alienated and isolated. And part of the result of that is they get easily more distressed.
Right. So even for somebody who is feeling depressed or anxious, even being involved in some sort of community organization or getting involved in something could even address that.
Absolutely. And this is why support groups work really well for people. I mean, if there are therapies that people can't afford, because even though it's registered, it's not covered by OHIP, unfortunately.
Right.
So it presents limitations for people. So joining a support group for whatever your issue happens to be, whether it's anxiety or you've got an addiction, whatever it is, that can serve that and offer you the kind of support and connection that you need.
Right.
So to get through the challenging time that you're having.
Right, because you're feeling a connection with the people there.
That's right. I'm not alone. Other people experience this. This is kind of normal. I'm doing pretty good. I get encouraged and supported.
Right.
Yeah.
And, and this worked for them. I'll try that maybe.
Yeah. Mm-hmm.
Encouraging each other.
Yeah.
Okay, that's great. So you did mention that the counseling isn't provided under OHIP or our plan. Now, for some people, though, they might have a work plan, benefit plan that it could be covered under.
Yes, and in fact, a lot of employers now have what they call EAP, Employment Assistance Programs, and through that, they can often get counseling. That's everything from career coaching to helping with the family issues, managing teenagers, couples challenges. So it's really important that if people are employed to see through human resources if their company offers an employment assistance program that includes them getting all kinds of support.
Right.
But particularly getting counseling.
And if we're seeing more and more employers offering that, there has to be some validity to it all, right? I mean, if they're starting to see that happy employees or productive employees are, people that show up to work every day and do well at their job. So if they're struggling, it's obviously going to affect their job performance too.
Right. So they know that the cost benefit is there to pay to have the service provided for their employees. Even though there's cost, they're saving money on absenteeism, on substance abuse issues, on people missing work because of relationship challenges, et cetera, et cetera. So it really is beneficial. And I think that's also in terms of psychotherapy over drug therapy, which is what we've been depending on for so long. Go to your doctor, get an antidepressant, and hopefully you'll feel better. Well, in fact, that's not as effective as going and getting counseling.
Right.
That actually empowers you more rather than thinking it's the pill that's making you better. You're learning how to help yourself through, and it's a tool that you get to use for the rest of your life.
Right. So, because what would you say to someone who said, well, I'm not going to go for counseling, my problem is an issue, I have to take medication? Would that be something you might challenge their thinking on, or?
No. They may be absolutely right. They know themselves better than I know them. But if they're talking to me, I'll ask them, but yet, you want to do that, and here we're having this conversation. Is there information that you need from me to understand better your choice?
Right, right.
But they may very well know that the way their brain chemistry works and their genetics are, that's something that they do need to do.
Right.
And being informed and being informed about all the options, no matter what your choices are in life, puts you in a position of feeling more empowered.
Right. And that's so key, right? Being that self-empowered and putting you back in the driver's seat. And then over time, who knows, maybe the medication might not be required if they start to get control over their own mind and feeling more in control of their own lives.
Yeah, exactly that.
Right. Wow. So in the time remaining, what would be maybe your wish, sort of culturally maybe, as in our society, on shifting a little bit more with mental wellness? Like, where would you like it to kind of start to head, or What would you like to start seeing happening
I think
culturally?
that it is starting to happen.
Okay.
I think that different people have stepped forward over a number of years. Must have been 15 or 20 years ago that Ron Ellis, the hockey player, stepped forward and said, I've been suffering from depression. And it's been going and increasing over time, where we're starting to look at this as an important issue. Even recently, the shootings in Ottawa, where there was, worry about this being a terrorist, and people recognized, wait a minute, this is a person who's sick. And identifying, okay, so people, when they're not well, often don't have places to go, or the family isn't able to help identify. So I would like there to be an awareness that when we're physically or mentally unhappy, that it's really important for us or the people around us to support us, to get the help we need to feel better, rather than feeling that, oh, it'll pass. For instance, certainly with young people, if a young person talks about being depressed or unhappy, you need to take that seriously. You really need to pay attention.
Right.
Just like if they said to you, I think I've broken my ankle. Well, just go to bed and see how it feels in the morning. Chances are you wouldn't say that.
No, that's right. You would say, let's pursue getting some help for that.
What do you think you need? How can I help you?
That's great. How can I help you? I love it. That's a great way to end off. So I am so grateful that you were able to come in and shed some light on mental wellness. I like that term, mental wellness, and that we all need to take some time to work on our own mental wellness. And I hope that you have found something helpful for you as you continue your journey of awakening within.